A new strain of COVID-19 has been detected in Arizona. The variant is named Stratus, and it joins the more prevalent Nimbus strain, which is associated with what's described as a razor blade sore throat. Here to give us an update on all this is Dr. David Engelthaler. He's director of the infectious disease at TGen and executive director of ASU's Health Observatory. Good to see you again.
Glad to be here, Ted.
Okay, it's called Stratus?
Stratus is the latest and greatest name that we're seeing.
Yeah. So are we seeing an increase overall in COVID cases in Arizona?
We have seen some indication there's been some slight uptick, but it's not true across the board from the indicators we have. And as you recall, we don't have a lot of great indicators anymore. We're not doing a lot of testing. We don't really know the full state of things, but it seems like it's at a fairly low level.
Especially compared to previous years.
That's correct.
Okay. What do we know about Stratus? I think it's XFG something. What do we know about this?
Yeah, this is really just the latest flavor of Omicron. Remember, when Omicron came out, that really wiped out all the other strains that were circulating, and that's all we've seen is different flavors of Omicron. So it's still that virus, the one that ended up being less severe, more the upper respiratory disease, the coughing, and not so much the pneumonia, the very sick illness. This is the same thing, and it's just the newest version of it.
Okay, and I mentioned that it was joining Nimbus. Is it joining Nimbus? Are they kind of mixing around right now?
Yeah, we have multiple subvariants of Omicron, Nimbus, Stratus, and then a few other with fancy names.
All relatives of Omicron.
Yeah, and they pretty much all act the same, so we're not really seeing any different disease than what we've been seeing over the last couple of years.
I was going to ask you, when it comes to Stratus, more so even than Nimbus, what are the symptoms? What do you look for?
Yeah, this is really settled in for most people as a pretty severe cold. Just like the other coronaviruses that we have that circulate around, this is one of them. And for most people, it's just a bad cold, bad sore throat, get the coughy, stuffy type of a thing. Other than that, it usually lasts for a few days and then it's gone. It's no fun. But some people have a more lingering illness for sure, and then we still have our at-risk groups.
With this Nimbus and this business of a razor blade sore throat, I mean, that sounds pretty tough.
Yeah, I think that's just more clever marketing.
I see, just to make sure that Nimbus gets its name out there.
Right.
Huh? Will Stratus likely become the most prevalent strain in Arizona? They seem to work that way, don't they?
They do. Really what's happening, if you recall, that it's that spike protein, right? That spike gene.
Yes.
We get a mutation in that, and then it can evade the antibodies that we got from the last infection. And so Stratus just has the right combination of mutations that's helping it evade the antibodies that maybe we got from an infection a year ago.
And it seems as though that with every strain, they become more contagious. Is that the case here?
I don't think this is true, and it's not necessarily more contagious. It just spreads better than the other ones because people don't have the right immune profile, the right antibodies right away to knock it down. So it is spreading very quickly, like all of Omicron.
As far as vaccinations are concerned, the latest, the newest, let's forget, what's out there right now, will Stratus be affected by that?
Yeah, it's a good question. The formulation that we have in the vaccines right now wasn't tested against Stratus. Stratus really came a little bit later. By and large, it's still going to give some protection. The immunity that you had from previous infections and previous immunizations also going to give you protection, and it's also mostly upper respiratory. So the overall risk pattern is going to be really low for most people.
And the vaccinations, I guess come fall, we're going to get a new batch, correct?
They're going to continue to put out new ones. So yeah, it will be targeting the last version, which is about 6 months ago. So it may not be perfect for whatever we're seeing once you get vaccinated, if you choose to do so.
But again, if they're all Omicron variants,
you're still getting enough protection that will certainly prevent you from getting seriously ill.
When COVID-19 hit, there was we know it was just terrible as far as the illness and the reaction. And this, as it's gone on, it's gone down. Why is that? Why is Stratus not COVID-19?
Yeah, you're right. We're really looking at COVID-25 now. This is the version of the virus that's settled in to have really the maximal ability to spread and keep generating and going between people, but not causing severe illness like the other coronaviruses that we have. They're all common cold viruses. So it's really acting like the common cold.
Do we know why that is?
Yeah, it is just that little tweaking of that one gene where we get those little mutations in the spike protein. It allows it to evade our antibodies so it can keep going.
Yeah. Once Stratus runs its course, are we going to get another exotic name coming around the pike next year?
Absolutely. I think they're getting a little more creative.
Yeah, but at what point do you think, I mean, we don't vaccinate ourselves against the common cold. At what point does that downward graph hit a level where vaccinations,
Yeah, well, as you know, vaccination recommendations are changing.
Yes.
And we're still seeing really strong recommendations for people that can get serious illness, and that's people over 65 or people with those heart conditions, lung conditions, diabetes, others. They're still recommended to get the vaccine. That's likely to continue moving forward. Everybody else, it's really a decision, and I think that's what we settled into. We don't have great uptake in people who aren't at high risk because it is like the common cold for most people.
You talked about recommendations. FDA approved, I guess, an updated COVID vaccine, but again, the recommendation's only for 65 plus and also younger folks at higher risk. Is that what we're going to be seeing here?
I think so. It's unfortunately what that does, though, is it does make it harder for people who really do want to get the vaccine that aren't in high risk because insurance may not cover it.
Oh.
Likely this year, everybody's still going to be good, at least until the end of the calendar year. But the recommendations may kick in at the beginning of next year. And then it'll be a little more difficult if you really want to get the vaccine and you're not recommended for it.
Yeah, and I don't want to get you in trouble here with the HHS secretary and stuff like this, but it sounds as though he may call for a limit to vaccinations, especially for younger children. The importance of vaccinations in general for the little folks. I mean,
I think we have just a great example of the importance of vaccines for kids, which is measles. And this outbreak that's been going on across the country, we're seeing more cases in Arizona in communities that don't have high vaccination rates. We know that we've been able to get rid of some of these bad diseases that would make our kids really sick or even kill them. We've mostly gotten rid of them. Now we're starting to see them creep back up because the changes in understanding around vaccine, as well as now recommendations and rules around vaccine.
herd immunity, is that being affected in any case?
We definitely are seeing that so like with measles and MMR vaccine, we're getting down below that kind of magic number. We're still high levels, probably above 90%, but below 95%, and that means the virus can still find its way around.
Well, I found it interesting, the American Academy of Pediatrics, they broke from the CDC. They do recommend vaccines for infants and young children.
They do. I think, especially for what we're talking about here is COVID, I do think that what we need is not to die on these specific hills of ideology around, say, COVID and what happened in the past. Really, let's focus on what is the scientific evidence saying. And there's a lot of scientific studies out there. Let's look at them. If it doesn't match up with an ideology, we still want to protect our kids.
Yeah, good information. Dr. David Engelthaler again with TGen and ASU Health. Good information. Good to have you here.
Yeah, good to be here. Thanks.